Hello everyone, welcome back to my OET channel. In this video, I'm going to talk about how to achieve grade B score in OET 2.0 writing, especially about how to write a good introduction. To reach a high score, you must expand your purpose clearly and apparently in your introduction paragraph. By doing this, you also give your examiner a very good impression. So in this video, I'm going to tell you how to write a good introduction. A good introduction must include these points: name, age, chief complaint, purpose. Which purpose and chief complaint are most important points here. After reading the writing task, you must bear in mind what is the situation. Always take these key points into consideration. The person who you are writing letter to, whether he or she knows the patient, if the situation is urgent, what's the purpose of the letter? Is it a discharge letter, referral letter, or transfer letter? You must expand on your purpose with the right details and sufficiently expanding the reason on your introduction. In terms of different type of letter, your introduction could be different. For example, a referral letter usually is about writing about further management of a certain disease of the patient or certain situation. A discharge letter normally is about recent treatment history. And a letter of transfer generally is requesting ongoing monitoring for the patient. Here are some examples of a different purpose. Thank you for seeing Mrs. Priya Sharma, a type 2 diabetic, for further management of her blood sugar levels. Mr. Spencer has been a patient at our hospital for the past 5 weeks and will be discharged tomorrow. He requires your ongoing support and treatment during his rehabilitation. Thank you for accepting Ms. Duncan into your care for the regular monitoring of his diabetes and encouragement to comply with his medication and dietary regimen. As you can see from the sample, different type of letter, you need to write a different purpose and expand in the detail. Here are some more samples follow-up. I'm writing to refer Mrs. Redford, a 77-year-old woman who is a resident at the Sunrise Retirement Home. She needs urgent admission to your hospital due to severe stomach pain. Or you can also write the letter like this. I'm writing to refer Mrs. Redford, a 77-year-old female resident at the Sunrise Retirement Home who needs urgent admission to your hospital due to severe stomach pain. As you can see in this introduction, the request is urgent admission, so your tone of letter should be immediately appear. The person who's going to read your letter should know the purpose immediately. This letter will introduce Mr. King, who is presently recovering from pneumonia. He is being discharged back into your care today and requires your ongoing care and management. For this introduction, you will know immediately patient is going back on care home, so it's back into your care. So the person who you write into know the patient. And the next example is about request a home visit. The purpose of this letter is to request daily home visits for Miss Granger, who has sustained a partial rotator cuff tear of the right shoulder. She is scheduled to be discharged today and requires expert assistance and management from your service for her speedy recovery. This is a very good introduction. You can immediately see the purpose and with the expanding the detail. I'm writing with regard to Mr. Baker, a 63-year-old man who was admitted to the hospital on the 4th of January and diagnosed with 9 small cell carcinoma of left lung. So this introduction clearly said the patient was admitted to hospital on 13 days and diagnosed with what type of disease. I'm writing to request a follow-up visit for this patient. Examination revealed that the vital signs were stable and left knee was swollen without infusion. Thank you for your time watching. If you do have any more questions, please do not hesitate to contact me. Good luck for your OET exam. Until next time, goodbye.